Hi, I'm Dr. Aston Goldfrey. In this video, we're going to talk about how to avoid a cervical fusion in your neck. So, how you avoid a cervical fusion in your neck is something that you need to start observing, much earlier in the process than before you're actually going in to start having a consult for surgery. Meaning, first it starts with us just being aware of our bodies. So, our posture. Everybody knows that they may have some bad posture, but if it starts getting to the point where your shoulders are really rolling and your head's dropping forward, you're setting yourself up for cervical injury. So a normal curvature in the neck allows the muscles that hold this head and neck up to do that job, okay? Because the neck's in a prime and optimal position for these muscles to actually do their postural muscle job, which is sustaining contraction and holding the head and neck up. But when the neck gets elongated, this anterior head carriage, these muscles aren't able to do that job by themselves anymore. It's kind of like if you were to take a bowling ball and hold it here and then try to hold it out here. You can't hold it out here as long as you can here. And that's the same scenario here. So what happens is your body has to recruit phasic muscles. And phasic muscles are designed for movement. They're not designed for sustained contraction. And so when those phasic muscles have to do a postural muscle's job, they're going to tighten. And when they tighten, they're going to decrease range of motion in the cervical spine. And so these nice segments in the neck, which are designed to move as individual segments, will start moving in pairs. And when they do, they're going to bend on like one segment more than the others. So when they bend on that one segment more than the rest, friction occurs in the joint space. And when, as you know from some other videos, friction leads to degenerative changes. Basically, when a joint doesn't move correctly, it rubs together and it starts to break down. And that's what happens in the cervical spine. Typically, these patients will start to experience headaches that kind of start in the base of the skull and can radiate behind the eye. Often confused with migraines when it's truly occipital neuralgia or a cervogenic headache. Often, these patients have not been done proper posture training, and if they've done PT, sometimes the PT hasn't addressed the real issue. They're just treating a symptom-based pain model where they're just trying to reduce the pain of that patient. So you really have to try to restore curve, and that's done by a combination of modalities, not just one type of physical medicine is going to treat that directly. Typically, it's going to involve some sort of bracing that's worn periodically. It's going to involve chiropractic care. It's going to involve physical therapy. It might even involve trigger point injections. Trigger points can form in the back, especially when the head drops forward like this. The shoulders typically roll, so you start to see an increase in curvature in this upper back. So these are some of the functional issues that occur, and in order to treat them properly, you need a combination of providers treating together who are aware of what the other's doing and all have the same objective or goal. So if you catch a patient early enough, you can keep them from having to have this cervical fusion, because we know with spine surgery, typically you have a 37% success rate. That means that those patients do not have pain for 3 years after the surgery. Well, that's not great odds. So that means a lot of these patients are going to have as much pain as they did before, or they're going to have more pain. And what we know about fusions is when you fuse a segment, it's going to affect the movement of the cervical spine even more. And so you're going to develop friction above it and below it. And when that occurs, you're going to see increased arthritic changes in those spaces. And it typically can lead to a second fusion. So it's really important to be self-aware about your posture. And if you start noticing these things, you start looking in the mirror and you start saying, hey, that's me. You need to go somewhere where they're going to do a functional assessment, actually address that issue, check it out, and see if they can actually treat it and fix it. I hope you found this helpful, and I hope this prevents you from having to have a cervical fusion.